What do NDIS SIL auditors check in worker files? Video number 2 of our series, Practical SIL Compliance Audit and Evidence Guidance. So 3 things to understand about file sampling. Files are sampled, not all are read. So an auditor typically selects a sample of workers, often across roles, tenure and houses. So every file needs to be able to stand on its own. Number 2, retrievability is part of the test. Evidence that exists but can't be produced on a day may not help you. Fast, organized retrieval signals a working system. 3, cross-checks tell the real story. Files are often read against rosters, incident records, and supervision schedules. Consistency between systems is what builds confidence. How auditors work through a file. Number 1, they select a sample across the roles, across houses and tenure. Number 2, they check the currency. Is the screening up to date? Is the training and refresher dates easily sourced, and are they accurate? Number 3, they match the role to evidence. Does the file support what this role does? Number 4, they cross-check the roster, so shifts versus authorizations at that time. And number 5, they follow the thread. Supervision, competency, corrective actions. So an example-only approach. In our experience, this is often the workflow that will be followed. Example questions an auditor might ask. Again, examples only. Auditors definitely have their own discretion and approaches may vary between audits, but here's some examples. Show me this worker's screening clearance and when it expires. What training did this worker need to support this particular participant, and where's the evidence? Who signed off this worker's competency and on what basis? When was this worker last supervised, and where's the record? This worker did a sole overnight shift last month. Walk me through how they were authorized for it. The roster cross-check, shifts versus the file. So on the left-hand side, what the roster shows, active overnight or sleepover shift. What the worker file may need to support is relevant training, current, plus any participant-specific requirements for that house. So again, on the left-hand side, the roster shows high-intensity support task delivered, what the worker file may need to support, specific skills, evidence, and competency assessment for that task. What the roster shows, first shift with a new participant. What the worker file may need to support is participant-specific induction completed for the shift. What the roster shows, sole worker in the house. What the worker file may need to support, emergency procedures and first aid requirements per the participant's risk assessments. So gaps that show up again and again. Number 1, evidence exists but can't be found. The fix to this is 1, consistent file structure per worker, digital where possible, with a named owner for workforce records. Number 2, expiry dates tracked nowhere. Fix a single register covering screening, training and refreshers reviewed monthly with actions assigned. Number 3, supervision undocumented. The fix is short, dated notes after each supervision, frequency per your policy, evidenced per session. Number 4, certificates without follow-through. So the fix is pair every certificate with assessment outcomes and practical competency evidence where required. The 10-minute retrievability test. So number 1, pick any worker, no preparation, no warning. 2, start the timer, give yourself 10 minutes. 3, produce 5 things, their screening, training, competency, supervision and induction records. 4, note the misses. Anything slow or missing is a gap. 5, fix the system. So structure and ownership, not one-off patching. If your team can pass this test for any worker, audit day gets a lot less stressful. Pre-audit worker file sweep. So this is before the auditor arrives, 8 items. So make sure that every worker's current screening is up to date and the register confirms this. Make sure their training records show the outcomes, not just the attendance. Refresher dates checked and they are up to date. Competency evidence on file for role critical tasks. Participant specific inductions complete for current allocations. Supervision notes dated and reasonably recent. Last fortnight of roster cross-checked against authorizations, and corrective actions from past gaps closed out and recorded. So we have a NDIS provider network up and running on School. You can get audit ready alongside other providers. It's $497 per month. For that, you get 1,138 compliance documents. So you get the new 0138 SIL modules for use. You also get 5 seats for training valued at $1,000 plus GST if you were to buy them separately. So again, you can go to school.com/NDIS-provider-network, jump in there for free, get some questions answered for free. But if you'd like to jump into the membership base and get those extra benefits, you can.